Hello, my name is Anna. I'm the clinical specialist from Sensing Future, and today I'm recording a video talking about concussions. So let's start with incidence. So we know that there are around 64 to 74 million new cases each year, and even though there's some studies that state that the majority of them resolve within 1 week to 1 month, there's also new evidence and evidence that suggests that it might not be that case, that around 58% of the patients show post-concussion syndrome, so they show symptoms over 1 month period. So what are the main symptoms of a concussion? We have headaches, of course, then we have dizziness, and dizziness is one of, or maybe the one that is more common within concussed patients, and then balance disturbance, okay, some kind of balance disturbance. And what are the problems that we have with concussions is that they are not easy to identify, and they are hard to monitor the progress. Without any objective assessment, we do not have a way to be certain on what the progress of the patient really is. And if we're talking about sports, we are not sure on what the timing of the returning to play is. So this is a big problem, and there's been a lot of effort to create new assessment tools that allow us to have objective view on balance, control, and vestibular function. So, and I'm going to try to show you and tell you about some of those tools. So let's move to here. For balance assessment, that we know that balance disturbance is one of the most common and most frequent complaints of a concussed patient. So there's different kind of protocols that we can do, and we can perform these protocols. And I am talking an objective assessment, so I'm talking about the posturography assessment that are performed using posturography plates. Can be pressure plates, or can be, and more common, force plates. Okay, just place it here so it doesn't fall. So we can perform these protocols, and all these protocols have been studied a lot, even in the sports context. So we have the modified STSIB, which is a very good assessment protocol for assessing concussed patients, since it assesses or evaluates the interaction of the sensory information, so the central integration of the information. We know that patients after concussion often show difficulties organizing and integrating information, so they take longer to read all the information coming from the different systems, and they take longer to respond to mismatches on this information, ignoring inaccurate cues, listening more to other sensory systems. They have difficulties, or a lot of people have difficulties on this. So the modified STSIB is a good protocol to perform to assess this component. Then we have the balance error scoring system, which is a bit more demanding. It's still a static analysis. It's performed with eyes closed in 3 different stances, and is used a lot, and has been created within this context of assessing concussed players, so sports. Then we have the limits of stability. The limits of stability is a dynamic assessment, so we are assessing postural stability in a dynamic state, and there's also been some studies showing that there's a reduction on the limits of stability after concussion, or it's frequent again. And then we have the COBALT, which is a recent protocol, and it's a very interesting one. The COBALT protocol adds two more conditions to the mCTSIB condition. So it has a VOR suppression condition, because again we know that concussed patients suffer or frequently suffer from visual motion sensitivity, so it's a condition that can identify concussed players more easily. And then we have another condition of head movement, rapid head movement with eyes closed, to increase the demand on the vestibular system also. There's evidence that states that this protocol might be more sensible to detect concussed players when compared to the modified STSIB. Okay, it's a bit more demanding. Then we have a vestibular oculomotor screening. Okay, so here we're just assessing balance and balance behavior, static balance and dynamic balance, sensory input and motor output. And here we are going to assess the vestibular and oculomotor function. Okay, it's important because if we think about the blow on the head, a hit on the head, it's easy to understand that in a high percentage of cases there might be also injury on the peripheral vestibular system that can lead to PPPV. So it's important to test and assess the vestibular system. We can assess the VOR in an objective way. There are tests and protocols to do that. We have the smooth pursuit motion, so it's the ability to track target in a slow movement. We know that around 43% to 63% of patients that suffer concussion have problems with the smooth pursuit movement. Then we have the saccades, which are ballistic eye movements to move our gaze from one target to a different one. And of course, if we are talking about playing a sport, and a sport like football, rugby, or almost any sport, these eye movements are fundamental and even for just the normal daily life, of course. So we know that around 21.6 to 30% of patients have difficulties performing saccadic movements. Okay, so they can overshoot or undershoot the target. Then we know vergence, so convergency and divergency. We know that concussed patients have difficulties in convergency mostly, and we know that around 30 to 56% of these patients show dysfunction, inefficiency. Then we have the fixation problems, so also they can be quite common, and VOR suppression, so the ability to suppress the vestibular ocular reflex. So we can do this assessment, or most of these assessments, using a video nystagmography to have objective data, or we can do, for example, another option to still have objective data. However, we are not assessing the eye movement itself, but we can assess balance while having the subject subjected to this kind of high movements, so this kind of high visual stimuli. So this can be using vestibular virtual reality headsets to have the visual stimulation of saccades, or smooth pursuit, divergency, fixation, VOR suppression. We can do that. At the same time, we are measuring balance, because we know when we have problems in any difficulties on these high movements, we can also find difficulties having a proper balance. So this difficulties or dysfunction on these movements will often show also difficulties maintaining balance. So we can use both technologies together. Okay, this is just some new tools that have been studied, and they have been heavily studied lately. There's already a lot of research on these topics, and I think it's very important to look into it and to invest it, because we are talking about very, very serious consequences when we know that, for example, a player is not ready to return to play after a concussion. We know that that can have catastrophic consequences. So this was just a brief discussion on concussions and some of the assessment that we can perform. I hope you like it. I hope you find it useful. If you want to know more about any of our technology or any of these studies, you can just visit us on physiosensing.net, or you can send us a message on our social network, Facebook, Instagram, LinkedIn, or YouTube, and we will get back to you. So thank you, and I think I will see you again soon. Bye.